If you feel dizzy when you stand up, do not blame your age yet, because the room may not be spinning because you are old. It may be spinning because your blood pressure is dropping the moment you stand. And in many older adults, the hidden trigger is not weakness. It is not laziness. It is not always dehydration. It may be one pill or a combination of pills sitting quietly on your kitchen counter. A blood pressure pill, a prostate pill, a water pill, a sleep pill, a nerve pain pill, or a medication from one doctor that became dangerous only after another doctor added something else. I am Dr. Adrian, and if you have ever stood up from the bed, the couch, the dinner table, or the bathroom and suddenly felt the room tilt, I want you to pay close attention. Because dizziness when standing is not a small symptom after 60. It can be the warning before a fall, and for many seniors, one fall can change everything. The bathroom fall, the hallway fall, the fall beside the bed at 2 in the morning, the fall that takes away confidence, the fall that makes your children say, maybe you should not live alone anymore. Before I explain the pills, I need to be very clear. Do not stop any medication on your own. Do not skip doses. Do not cut pills in half. Do not stop a blood pressure pill, prostate pill, or heart medicine because of this video. Some medicines must be reduced slowly. Some are protecting your heart, kidneys, rhythm, or prostate. The goal is not panic. The goal is a smart conversation with your doctor before the dizziness becomes a fall. Now let me show you what may be happening inside your body. When you are sitting, your blood pressure may look perfect. 120/75, 130/80. Your doctor may look at that number and say, everything looks fine. But the problem is not always what your blood pressure does while you sit. The problem may be what your blood pressure does when you stand. The moment you stand up, gravity pulls blood downward into your legs and lower body. Your brain still needs blood immediately. So your body has a rescue system. Tiny pressure sensors in your arteries detect the drop. They send a message to the brain. The brain tells the heart to beat a little faster. It tells the blood vessels to tighten. The vessels squeeze blood back upward. The brain keeps receiving oxygen. You stand up and feel normal. That is how it should work. But if that rescue system is blocked, weakened, slowed, or overpowered by medication, the blood does not return fast enough. Your pressure drops. Your brain gets less blood for a few seconds. And that is when the room moves. Your vision gets gray. Your legs feel empty. You reach for the wall. You pause before walking. You tell yourself, I am just getting old. But maybe you are not just getting old. Maybe your standing blood pressure is crashing. This condition is called orthostatic hypotension. In simple words, it means your blood pressure drops when you stand. And the dangerous part is this. You can have a normal blood pressure while sitting and an unsafe blood pressure while standing. That is why so many people are missed. Now, dizziness can have many causes. Inner ear problems, low blood sugar, anemia, dehydration, heart rhythm problems, infection, bleeding, neurological disease, vision problems, diabetes-related nerve damage. So I am not saying every dizzy spell is from a pill. If you have chest pain, fainting, severe shortness of breath, sudden weakness on one side, trouble speaking, black stools, severe headache, a new irregular heartbeat, or repeated falls, get medical care urgently. But if the dizziness happens mainly when you stand up, especially in the morning, after meals, or during nighttime bathroom trips, then medication must be reviewed. Now let me tell you about a man I will call Russell. Russell was 69. He still walked the golf course. He still drove himself to the hardware store. He still carried grocery bags without asking for help. Then one day, he bent down to place a golf tee. He stood back up, and the world tilted. He grabbed the golf cart and waited. His friend asked, "Are you okay?" Russell said, "I must be dehydrated." But the same thing happened again. Then it happened when he stood from the dinner table. Then from the couch. Then at night, on the way to the bathroom, he touched the wall without thinking. That was the moment that scared him. Not because the dizziness lasted long, because he knew he had started doing something older men do when they are afraid of falling. He was holding the wall. When Russell went to the doctor, his seated blood pressure looked normal. That is the trap. Normal while sitting, dangerous while standing. When his blood pressure was checked after standing, the top number dropped sharply. That was the missing clue. His body was not failing all day. It was failing during the first minutes after standing. And one of the suspects was a prostate medication from the alpha blocker family. This is the first medication group I want you to understand, alpha blockers. Some alpha blockers are used for blood pressure, some are used for urinary symptoms from an enlarged prostate. Common names include doxazosin, prazosin, terazosin, tamsulosin, alfuzosin, and silodosin. The blood pressure alpha blockers, especially doxazosin, prazosin, and terazosin, are well known for causing dizziness when standing in older adults. Prostate alpha blockers, like tamsulosin, are often more targeted toward urinary symptoms, but they can still cause dizziness or standing blood pressure problems in some people. This is why many men never connect the symptom. They say, I am not taking that pill for blood pressure. I am taking it for my prostate. But your body does not care why the pill was prescribed. If the medicine relaxes blood vessels at the wrong time, your pressure may fall when you stand, and that can put you on the floor. This does not mean every man should stop his prostate medicine. Some men truly need it. But if your dizziness began after starting it, increasing it, or combining it with other blood pressure pills, that timing matters. Do not ignore the timing. Now, the second group is water pills, also called diuretics. These include hydrochlorothiazide, chlorthalidone, furosemide, torsemide, bumetanide, and spironolactone. These medicines help the body remove salt and water. They can be very useful for high blood pressure, swelling, heart failure, and other conditions. But if they remove too much fluid, your blood volume can become too low. And when blood volume is low, there is less blood available to push back up to the brain when you stand. That is when you feel lightheaded. This is often worse in the morning. You have been lying down all night. You may have urinated during the night. You may not have had water for many hours. Then you stand quickly. Your body is starting the day with less circulating fluid. Your pressure drops. The room tilts. If you take a water pill and you feel dizzy when standing, do not stop it yourself. Ask your doctor, is my dose still right? Are my kidney function, sodium and potassium okay? Could I be dehydrated? Is the timing of this medicine increasing my morning dizziness? Those are the right questions. Now the third group is beta blockers. These include metoprolol, atenolol, bisoprolol, propranolol, and carvedilol. Beta blockers slow the heart and reduce how hard the heart works. For some people, they are very important. They may be used for rhythm problems, chest pain, heart failure, or after certain heart events. But when you stand, your heart may need to speed up slightly to keep blood flowing to the brain. If the heart cannot respond enough, some people feel weak, slow, or dizzy when they stand. Carvedilol deserves special attention because it can also affect blood vessel tone. For the right person, it can be useful. For the wrong person, or at the wrong dose, it can contribute to standing dizziness. Again, the medicine is not automatically bad. The question is it still right for this person at this dose with these symptoms? Now the fourth group is calcium channel blockers. These include amlodipine, nifedipine, felodipine, and similar medicines. They relax blood vessels and can lower blood pressure effectively. Many people tolerate them well, but in some older adults, especially when combined with other blood pressure medicines, they can contribute to dizziness, swelling, or low pressure symptoms. And the key word is combined. One medication may be fine, two may be too much, three may create a fall risk. That brings us to the most important point in this video. Many seniors are not dizzy because of one pill. They are dizzy because of the stacking effect. One pill relaxes vessels. One pill removes fluid. One pill slows the heart. One pill helps sleep but makes the brain slower at night. One pill helps nerve pain but increases fall risk. One pill helps the prostate but lowers standing pressure. Each medicine may have a reason, but the body experiences all of them together. The cardiologist looks at the heart pill. The urologist looks at the prostate pill. The primary doctor looks at the blood pressure pill. The pain doctor looks at the nerve pain pill. The sleep aid is bought over the counter. But nobody sits down and asks, what happens when all of these are inside one older body at 2 in the morning? That is where danger hides. Let me tell you about Doris. Doris was 76. She had diabetes, ankle swelling, nerve pain, and an irregular heartbeat. She took a water pill for swelling, a beta blocker for rhythm, and an older nerve pain medicine at night. Each prescription made sense by itself, but when she stood up, she felt like the strength drained out of her legs. Not spinning, not nausea, just empty, weak, unsafe. Her daughter began helping her off the couch. Then Doris stopped going to church. Then she stopped driving. Then her family started saying, maybe it is time for you to move in. Doris said, I feel like I aged 10 years in 3 months. But she had not aged 10 years. Her medication burden had changed how her body handled standing. The water pill reduced volume. The beta blocker limited heart rate response. The night medicine added sedation and blood pressure effects. 3 pills. 3 different reasons. 1 dangerous result. Once one clinician reviewed the full list together, the plan changed. Not suddenly, not recklessly, carefully, under supervision. And that is why I am making this video. Because dizziness is not always weakness. It is not always age. Sometimes it is physiology. And physiology can be measured. Now, let us talk about sleep medicines and nerve pain medicines. Many older adults do not think of these as fall risk medicines, but they can be. Trazodone is often used for sleep. Amitriptyline and nortriptyline are sometimes used for nerve pain, headaches, or sleep. Diphenhydramine, found in some over-the-counter sleep aids and allergy medicines, can cause sedation, confusion, and unsteadiness in older adults. Zolpidem and similar sleep medicines can increase fall risk. These may not be blood pressure pills, but they can still affect balance, alertness, blood pressure response, and nighttime safety. The most dangerous trip is often the bathroom trip. 2 or 3 in the morning. Dark room, sleepy brain, lower fluid volume, medication still active. You stand too quickly. You take 2 steps. Then the floor comes up. That is how many serious falls happen. So when you review your medication list, include everything. Prescription pills, over-the-counter sleep aids, allergy pills, pain pills, prostate pills, heart pills, supplements, alcohol use, everything. Your doctor cannot review what you do not mention. Now I need to say something important for men. Erectile dysfunction medications such as sildenafil, tadalafil, and vardenafil can lower blood pressure by relaxing blood vessels. For many men, they are helpful. But if they are combined with prostate medications, multiple blood pressure medicines, or especially nitrates like nitroglycerin, the pressure drop can be dangerous. Never combine erectile dysfunction medicine with nitrates. And if you take prostate medicine or several blood pressure medicines, ask your doctor or pharmacist about timing and safety. Do not be embarrassed. This is not a moral issue. It is a blood pressure safety issue. Now, let us talk about the test that may reveal the problem. It is called orthostatic blood pressure measurement. It is simple, but it is often skipped because appointments are short. The idea is this. Check blood pressure after lying down or sitting. Then check it again after standing, usually at 1 minute and 3 minutes, sometimes longer if symptoms happen later. If the top number drops by 20 or more, or the bottom number drops by 10 or more, that supports orthostatic hypotension. But do not focus only on the number. Symptoms matter too. If you feel dizzy, gray, weak, faint, or unstable when you stand, that matters. The timing matters. Does it happen immediately? After 1 minute? After 3 minutes? After 10 minutes? After meals? At night? In the morning? After a new medication? After a dose increase? Patterns are clues. Now, you can gather useful information at home, but do it safely. If you are at risk of falling, have someone nearby. Do not do this alone if you have fainted before. Do not do it if you feel unsafe. Use a proper upper arm blood pressure cuff if you have one. Lie down quietly for 5 minutes. Take a reading. Stand carefully. Take another reading at 1 minute. Take another at 3 minutes. Write down the numbers and symptoms. If symptoms happen later, write down when. Then bring that information to your doctor. Do not use the numbers to change medication yourself. Use the numbers to start the right conversation. Now, while you wait for your appointment, there are safety steps that may help reduce risk. These do not replace medical care. They protect you while you get evaluated. First, stand in stages. When you wake up, do not jump out of bed. Roll to your side. Sit up. Pause. Move your ankles. Tighten your legs. Take a few breaths. Then stand slowly while holding something stable. This one habit can protect the most dangerous stand of the day. Second, hydrate appropriately. Some people with standing dizziness improve when they are better hydrated, but this depends on your condition. If you have heart failure, kidney disease, severe swelling, or a fluid restriction, ask your doctor how much fluid is safe. Do not force large amounts of water without guidance. Third, use muscle squeezing. Before standing, tighten your calf muscles. Pump your ankles, squeeze your thighs, clench your buttock muscles. If you feel lightheaded, cross your legs and squeeze your lower body if you can do it safely. These movements help push blood back toward the heart. Fourth, be careful after meals. Large meals, especially meals high in carbohydrates, can pull blood toward digestion. Some older adults feel more dizzy after eating. If this happens to you, do not jump up right after dinner. Pause. Stand slowly. Consider smaller meals. And tell your doctor this pattern. Fifth, protect the nighttime bathroom trip. Use a nightlight. Clear the path. Remove loose rugs. Sit before standing. Keep a stable support nearby. Consider a bedside urinal or commode if falls are a real risk. That is not weakness. That is prevention. Sixth, ask about compression. Compression stockings or abdominal binders can help some people by reducing blood pooling in the legs and abdomen. But the type and fit matter. Ask your clinician what is appropriate. Seventh, ask about salt only if your doctor approves. Some people with low standing pressure benefit from more salt. Others should not increase salt because of heart failure, kidney disease, uncontrolled high blood pressure, or swelling. Do not do this on your own. Now, let us talk about your home blood pressure cuff. Bad data can lead to bad decisions. A wrist cuff is often less reliable than a properly fitted upper arm cuff. The cuff must fit your arm. Your feet should be flat on the floor. Your back supported. Your arm supported at heart level. Do not talk during the reading. Rest before measuring. If your arm hangs down, the number may be wrong. If the cuff is too small, the number may read too high. If the cuff is too large, it may read too low. Bring your cuff to your doctor's office once and compare it with their machine. That one step can prevent years of treating the wrong number. Now I want to give you the exact words to say to your doctor. Bring this with you. Doctor, I have been feeling dizzy or weak when I stand up, and I am worried about falling. I would like to check my blood pressure lying down or sitting, and then again after standing at 1 minute and 3 minutes. I also want to review all of my medications, including prescriptions from other doctors, over-the-counter sleep aids, prostate medicines, pain medicines, and supplements. Could any of them be contributing to orthostatic hypotension or fall risk? I do not want to stop anything on my own. I want to make any changes safely under your supervision. That is the script. Calm, specific, respectful, hard to dismiss. If you take an alpha blocker, ask this. Doctor, I take an alpha blocker. Could this be contributing to my dizziness when standing, and are there safer alternatives or timing changes for my situation? If you take a water pill, ask this. Doctor, could my diuretic be lowering my blood volume or electrolytes too much? Should we check kidney function, sodium, potassium, and whether the dose or timing is right? If you take a beta blocker, ask this. Doctor, is my pulse too low when I stand? Could this medication be limiting my heart's response and contributing to weakness or dizziness? If you take sleep or nerve pain medicine, ask this. Could this medicine be increasing my fall risk, especially at night? And if you get medications from more than one doctor, ask this. Can one clinician review my entire medication list together? That may be the most important question of all, because the full list tells the truth. Now your doctor may use a safety tool called the Beers criteria. This is a guide that helps clinicians identify medications that may be risky for many adults over 65. It does not mean every medicine on the list is forbidden. It means it deserves caution, review, or a safer alternative when possible. Certain alpha blockers, some sleep medicines, and some older antidepressants are important in older adult fall risk discussions. You can ask, can we review my medicines using older adult safety criteria? That is a serious request. Now I want to be honest. Sometimes the answer will be, you still need this medicine. That may be true. A medicine can contribute to dizziness and still be necessary. A heart medicine may be protecting you. A water pill may be needed for heart failure. A prostate medicine may be helping severe urinary symptoms. The solution is not always stopping. It may be lowering the dose, changing the timing, switching to another option, removing another interacting medicine, treating dehydration, checking electrolytes, improving home safety, using compression, or monitoring more closely. Good medicine does not make one blind move. It weighs benefit against risk. Now let us return to Russell. The reason his story matters is that his seated blood pressure looked good. That is what fooled everyone. But his problem was not sitting. His problem was standing. So the test had to match the symptom. If the symptom happens standing, measure standing. If it happens after meals, discuss after-meal blood pressure drops. If it happens at night, review nighttime medication and bathroom safety. If it began after a new pill, bring the date. If it worsened after a dose change, bring the date. Doctors need patterns. You are the person living the pattern. Write it down. Now I want to speak to the family member watching this. If your father holds the wall at night, do not just call him stubborn. If your mother feels weak when standing, do not just say she needs to exercise more. If your spouse fell and cannot explain why, ask whether blood pressure dropped. Look at the medication list. Ask about prostate pills. Ask about water pills. Ask about sleep medicines. Ask about nerve pain medicines. Ask whether anyone has checked standing blood pressure. You may notice the pattern before the patient does. Your observation may prevent a fall. Now here are the warning signs that should not wait. If dizziness comes with chest pain, fainting, shortness of breath, sudden weakness, trouble speaking, new confusion, black stools, vomiting blood, severe headache, repeated falls, or a new irregular heartbeat, get urgent medical care. But if your dizziness is recurring, positional, and linked to standing, schedule a medication and orthostatic blood pressure review. Do not wait until after the fall, because a fall after 65 is not always just a fall. It can start a chain. Emergency room, hospital, surgery, rehab, fear, loss of confidence, loss of independence. That is why this matters. Not because every dizzy spell is catastrophic, but because repeated standing dizziness is a warning worth respecting. Now I want you to do something today. Do not change your pills. Just gather the information. Write down every medication name. Blood pressure pills, prostate pills, water pills, heart pills, sleep pills, pain pills, nerve pills, allergy pills, supplements. Then write down when dizziness happens. Morning, after meals, at night, after standing from the couch, after bending over, after taking a certain dose. Then write down whether you have fallen or nearly fallen. That list is powerful. Bring it to your doctor. Bring it to your pharmacist too. Pharmacists are excellent at spotting medication interactions and fall risk combinations. Now, let me give you a simple morning safety routine. Before standing, sit on the edge of the bed, move your ankles 10 times, tighten your thighs, take a slow breath, stand with one hand on something stable. Wait before walking. If you feel dizzy, sit back down. Do not push through. Do not be proud in a dangerous moment. The goal is not to stand fast. The goal is to stand safely. After meals, pause before getting up. At night, turn on a light. Sit before standing. Clear the path. Use support. That is not weakness. That is wisdom. Now I know some people are thinking, I do not want to bother my doctor. Please do not think that way. A medication-related fall is far more serious than a medication review. Calling the office is not bothering anyone. It is responsible. You are not asking for special treatment. You are asking for safe treatment. That is exactly what older adults deserve. So let us bring this together. The dizziness when you stand may have a name. Orthostatic hypotension. It may be related to medication, especially alpha blockers, diuretics, beta blockers, calcium channel blockers, central agents, prostate medicines, sleep medicines, older antidepressants, or combinations. Your seated blood pressure may look normal. Your standing blood pressure may tell the truth. The solution is not stopping medicine suddenly. The solution is measuring correctly, reviewing the full medication list, identifying risk, and making supervised changes. That is how you protect your brain, your heart, your kidneys, your balance, and your independence. If this video describes you, do not ignore it. Do not wait for the fall. Do not accept it is just age without checking. Age may be part of the story, but medication may be part of the story too, and medication can be reviewed. Before your next appointment, write down 4 things: your medication list, your dizziness pattern, your blood pressure readings, if you can take them safely, your fall or near-fall history. Then say to your doctor, I want to find out whether my standing dizziness is related to orthostatic hypotension or medication effects. That sentence may change the conversation, and changing the conversation may protect your independence. I am Dr. Adrian. Do not stop your medication on your own. But do not ignore dizziness when you stand. Because the goal is not just a good blood pressure number while sitting. The goal is standing up in the morning, and the room stays still. Walking to the bathroom at night without holding the wall. Standing from the dinner table without fear. Stepping outside without wondering if your legs will fail you. That is what safe treatment should protect. And if one pill, or one combination of pills, is quietly stealing that from you, then it is time to ask the question, Doctor, is my medicine making me dizzy when I stand?